Hi, my name is Nathan Wong from the University of California, Irvine, and we're here today to talk about various safety issues around certain cardiovascular preventive medications. And with me today, we have Professor Tony Heagerty, who is from Manchester, here in the United Kingdom. We also have Professor Eberhard Standl, who is from Munich, and he's an endocrinologist. And finally, we have Professor Larry Sperling, who is from Emory University in Atlanta, Georgia. I guess, we're certainly aware that there's been issues raised regarding certain preventive medications, and certainly there's the concern by some whether perhaps the harms might exceed the benefits. Maybe you'd like to expand on this issue for us, Dr.
Yeah,
Sperling.
certainly. As in the world of preventive cardiology, there's a lot we can do to help our patients. First and foremost, that should be always lifestyle and behavioral interventions, but there are many medical therapies that can help prevent cardiovascular events. And certainly for each of our patients, we should think about the indications of those medicines, the risks, the side effects, and try to think about a concept of net clinical benefit. Importantly, for each of our patients, we want to have a meaningful discussion and partnership, getting a sense of what are the goals and objectives of care, the risk of that patient, and then really having what would be a therapeutic team relationship as we move forward. And as we think about medicines, yes, there are potential risks, but we also should really emphasize the potential gains or benefits.
Yeah, I completely agree with you. I think the actually patient-clinician discussion and clearly describing to each patient the potential risk and the benefits are extremely important. Now, we've certainly heard a lot about certain medications, in particular statins and diuretics, potentially causing or at least promoting the development of diabetes in actually certain patients. What are some of your thoughts regarding this? Perhaps Professor Standl, you have some
certainly
ideas about
we
this,
are
yeah.
using very common drugs which in fact are life-saving. They reduce cardiovascular complications. But when used in people with diabetes, there are some potential downsides which we should know, some glucose worsening, or also in people prior to diabetes, manifestation of diabetes. But this is not the main issue. We have to know about this and compensate for that by lifestyle, other means. But first, the indications for the drugs are so important.
Yeah, and then I guess how about for certain antihypertensives? There's certainly been some data around diuretics and potentially some other therapies.
Certainly the older drugs such as thiazide diuretics and beta blockers have been labeled by our patients because of their looking at popular press releases as being drugs that could give them diabetes. And so if clinicians attempt to prescribe them, they must be ready to address this issue with their patients. And there is no question that both these agents can contribute to glucose intolerance and increase the risk of developing diabetes, but that risk is relatively small compared with the newer antihypertensive drugs, and is outweighed by the benefits that the patients will receive if they have their blood pressure well controlled.
Exactly. And I guess certainly many times our patients in particular are very concerned about statins. And how do you best explain the potential risk versus the benefits of statins to your patients?
Yeah, statins are still one of our most important medications in our preventive toolbox. And patients at risk, and certainly a patient with diabetes or pre-diabetes, would be a patient that is often at risk for cardiovascular disease. If we look at the statins and the risk for diabetes, I do believe that risk is real. That risk appears to be more potent or more prominent with statins that are more intensive in their dose and in their potency. What we should think about with our patients, though, is what is the net clinical benefit for the medication. And by that I mean, what's the benefit of the medicine? And the benefit should be cardiovascular risk reduction. We know that's anywhere in the range of 25 to 40% relative risk reduction.
Right.
And then the risk for diabetes, importantly, statins don't cause diabetes. They do take people who have the genes for diabetes and can push them or nudge them over the threshold. That doesn't mean we should withhold statins in those individuals. It's an opportunity to talk to those individuals about their risk for diabetes, focus on intensive lifestyle and behavioral interventions, and at the same time talk about benefit versus risk, and often the benefit greatly outweighs the risk.
Yeah.
Perhaps one number, 70% of all people with established cardiovascular disease have either diabetes known or undiagnosed or pre-diabetes in the background. So this is a risky population, but still the matter is saving lives and knowing what our potential downsides.
Totally agree. And I guess a final brief comment from you?
Well, I have to say that as Larry has just reiterated, these patients will almost invariably develop diabetes because they have the propensity to develop it. But in doing so, if we do precipitate it in a very small minority of patients, they still are going to benefit from having their blood pressure lowered with thiazide diuretics. And that's the important point.
Exactly. So we've established today that certain preventive medications, in particular statins and certain antihypertensives, do carry certain risk as well as benefits that we clearly need to understand. Thank you very much.